I see we have a student. Brian, can you hear us? Hello? Oh yeah, he said yes. All right.
Okay.
So yeah, Shante, please just introduce yourself, and then we're here to support anything you need. If Brian has any questions, he can ask
Okay.
anytime, and we can start.
Yeah. Okay. Well, thanks, Diego and Evelyn, for organizing this. I think this is awesome. So we're going to go ahead and get started. So my name is Ashante Marshall. I am the coordinator of the Student Disability Services here at Morton College. And we're just going to go through a few slides that just kind of explains what the services are, how to request accommodations, what type of documentation that you would need. If you have any questions during this presentation, you can stop me and ask, or if you want to type it. I also included my email at the end of the presentation, so if you want to email me directly, if you don't feel comfortable asking in the setting, that is totally fine. You can just send me an email as well. So what I first want to go to is just defining what a disability is. And a disability is the term, it means a physical or mental impairment that substantially limits one or more of your major life activities. For example, walking, talking, thinking, seeing, speaking, or hearing. Those are what we classify as disabilities. Now, what my office does, we provide exam aids for students, we provide faculty and staff notification, and that just means providing faculty with an accommodation letter once you establish services with my office. We can also hook you up with different agencies. So let's say you don't have supportive documentation, let's say you've been out of high school for years, or you just never been diagnosed with a disability, I can work with Department of Rehab Services to get you tested to determine if you do have a disability for free. And then we also have note takers. We have reading services. We do referrals. We provide sign language interpreters for students who may need that. And we also do provide captioning services for students who need that as well. Special test accommodations, workshops, and faculty and student consultations. And what I mean by that is this semester, well, last semester, I've been doing a lot of one-on-ones with the faculty and the student to figure out best ways to accommodate the student. Even though they have the accommodation letter, there's still like some gray areas. So I've been working with the teacher and the student, kind of doing those. So when you're requesting accommodations, to receive services, students with disabilities must register with Disability Services, and you must provide us with documentation of your disability. Again, if you don't have documentation, I can work with you to get that, so don't be discouraged if you don't have it. And then you can call or visit the Disability Services to schedule an appointment. Again, I left my information at the end of the slides, but I'll provide that with you. And then again, you provide documentation. Now, the goal is to always have documentation in at least 6 weeks before classes start, just to ensure that you get all the services that you need. We have some students who request audiobooks, some students who request sign language interpreters, and those and note takers. That takes a little bit more time to schedule. So we like to have those, we like to know what you need in advance so we can request that, because the audiobooks sometimes can take a little while for me to get access to if that is something that you're gonna need. And then you can have a permanent disability or a temporary disability. We have had students that have had broken arms, their leg, things like that. So it's just a temporary thing. You can still receive services for that. We had a student last semester who broke their arm and they needed a note taker just for that semester. So that is definitely something that you can use. So let's get into the documentation. So for documentation, it must be determined by a licensed physician or your primary health provider, psychologist, audiologist, speech therapist, learning disability specialist, or any other appropriate professional. We can also take documentation from social workers. The documentation must be based upon your history, patient and family interviews, testing, medical, or neurological examinations. Now, when it says family interviews, sometimes that does happen if you're being tested for different learning disabilities or maybe mental health diagnosis. So that's something to keep in mind. And then documentation must be provided by a qualified professional, such as, again, what we just stated, a learning disability specialist based on your appropriate testing. For disabilities such as psychiatric disabilities, specific diagnostic classifications such as DSM-5 or now it's 5 and 6 must be supplied where appropriate. And your documentation must be on letterhead of the professional who diagnosed your disability. Documentation must be current. We like to have it within the last 3 years here at Morton. So if you don't have that, I can work with you to get that. Documentation requirements may be modified where disabilities and need for accommodations are obvious. So these are just some examples of that documentation. So if you have a visual impairment, you can bring in a current vision report. If you are deaf or hard of hearing, you can bring in your audiogram. If there is a mobility impairment or medical disability, you can bring in documentation, your current medical records. There's a learning disability, you can bring in your psychological evaluation and IEP from high school. And then now we're going to switch gears just a little bit to go over the differences between high school and college accommodations. So in high school, they go by the law called IDEA and Section 504, and that only covers K through 12. Now in post-secondary ed, which is Morton College, we follow the ADA guidelines, which is Section 504. And these are the laws that we kind of follow. Now, for the idea when you're in high school, it's basically an entitlement thing. Like, let's say in high school, you received, you can use copy of class notes on tests and things like that. In college, that is definitely a little bit different. That's not necessarily a reasonable accommodation for most classes. So that is something that we can talk about more in depth. And then I just kind of want to skim down to the accommodation part. So extended time is something that you may have gotten in high school, modified tests, readers, resource room, adaptive equipment, note takers, tape recorders, recorded textbooks. But in college, it's on an individual basis. Now, we do provide extended time on tests. We do provide note takers. We do provide adaptive equipment. We do provide tape recorders, and we provide audiobooks. But there may be some things like assistance with homework. That's not something that the college necessarily provides. That's something that you can do with tutoring and other services that we offer. So there are a lot of differences between high school and college when it comes to accommodation. I just wanted to put that slide in there to show that. Okay, so disability services, these are just kind of some of the ground rules that we have. We have the right and responsibility to request appropriate documentations from a student, deny immediate requests for accommodation if the student has not honored our timelines. So if you're coming in today and let's say you need accommodations for tomorrow and we're not able to get all of your paperwork, we may have to deny that until we can get everything in order. Of course, I'm always going to try to work with the student initially to get you everything that you need, but it's very important to try to follow the timelines if possible. Even if it's just a week or two out before the classes start, that's just so helpful in helping me get you the best accommodations that you can, because we know there's a huge rush when fall classes start and then students are scrambling, and I just don't want that to be the case for you. Now, providing a reasonable and appropriate accommodations, that's something that we definitely are going to be doing for you. Providing auxiliary aids and services as appropriate, inform faculty of medical or safety concerns, like if there's some type of seizure disorder, we're going to give the faculty in your class and the staff on campus that information, the appropriate people, and then we're going to act as an advocate for you. Okay? And students, you have the right to have appropriate accommodations for your disability. You get equal access to education. You have the right to confidentiality and equal and fair treatment. And then you also have the right to be your own advocate. That is one of the goals that I try to push for students. Of course, I'm going to help you advocate, but the ultimate goal is for you to be your own advocate, and we can work on that together. Disclose relevant information regarding your disability, initiate all services in a timely manner, scheduling tutoring even if you don't need it. I always suggest that to students. And they're also doing tutoring via Zoom now, so it is available remotely. And then meet each semester to review your academic plan. And that just means like, you've already worked with your advisor, just so we know like what classes are coming up so we can provide the appropriate accommodations, maybe even sending emails to your teachers just to make sure that all of your accommodations will be in line with what you need. Okay, and then what is meant by, you keep hearing me say accommodations and reasonable and all of that. So what is meant by that? Any accommodations that are given to a student are meant to level the playing field for you, not to give you an advantage, but to level the playing field so that everything is fair and equal to you. All accommodations provided by the Coordinator of Student Disability Services are based upon your student needs. The accommodations will be determined after we have a review of your documentation and you and I have a one-on-one consultation between the student and the coordinator. Accommodations are not provided retroactively, so that means that if you see me on a Friday and you needed accommodations for the past Monday, we can only start accommodations from the day you come in to see me. Now, accommodations are not reasonable if they make a fundamental change in the standards of a program or course, alter your course objectives. So that means that if you're in a math class and your teacher is just trying to see how you do with addition, subtraction, and you need to use a calculator, that may alter the course objectives. Impose an undue financial or administrative burden to the institution, or pose a direct threat to the safety of yourself or others. Now, I did want to get into this because I didn't know if we were going to have some parents on here, so I'll just kind of breeze through this because I don't know if we do, but we may have some that may watch the recording later. So it is important to note that your role as a parent does change in higher ed when it comes to your students' IEP, their psych eval. Things are a lot different. So we're just going to get into this first question that I get a lot. How has my role changed as a parent? So the student is legally responsible for making all decisions about their education. The parent no longer participates directly in the institution's decision-making process. So the parent may continue to offer the student advice and support, but the student becomes solely responsible for communicating with the college personnel about their disability-related matters. The college understands that this may be a difficult transition for the parent as well as the student, and we welcome the opportunity to provide advice and general information about students with disability. However, the college will not recognize the parent or guardian as a substitute for the student as it relates to providing services. So anytime you're in the intake with me, I am going to be speaking more so with the student. Of course, I welcome the parent's input, but we are going to be letting the student take the driver's seat with that. And then this is another frequently asked question that I get from parents. Can I request accommodations or adjustments on behalf of my son or daughter? And the answer to that is no. It is the student's responsibility to request accommodations and adjustments and to adhere to the institution's accommodation policies and procedures and to actively participate in the process. The demand of the parent do not obligate the institution to act as if the student fails to satisfy the responsibility. We have to talk to the student to set up accommodations, add accommodations, and contact their professor if there is an issue. The accommodations are the students and not the parent. And then the last question that I get a lot about from parents is, can I disclose information? You disclose any information to me about my son or daughter's services or classes? And the answer is simply no. We follow FERPA's guidelines, and that prohibits us from giving any information to the parents or guardians without the student's permission. about disability services, about their grades or anything like that, there is paperwork that you can fill out with the admissions office if that is something that the son or daughter wants to do, but we cannot freely give away that information. And then here, I'm just going to open it up for questions, and then I'm going to kind of put this slide here so you have my email address. Do we have any questions so far?
Bryant, do you have any questions that you might have for Ashanti? No? Okay.
It's okay. And if you, like, again, if you don't feel comfortable asking here, please email me, okay? We can chat. I can give you a call, or we can set up a Zoom meeting. We can talk about, you know, whatever questions you may have.
Okay. So her email's right here on the last sheet. It's ashanta.marshall, marshall, @morton.edu. So if you have any questions, you could send her an email. If not, since you wrote no, thank you for joining us, Bryant, and thank you, Ashanti.
Oh, thank you. And then sorry that it wasn't 40 minutes, but
No,
yeah.
you're fine. It
I didn't want to bore them.
No, you're fine. You're fine.
Okay.
You could yeah, stop the recording and then you're done.
Okay, and then I'll send you guys, I'll send it to you, Evelyn, as soon as we get off the call. But thank you guys so much for thinking of me to include me in this.
No problem. Thank you for doing this.
Okay, no problem. Have a good one.
You too. Bye.
Bye.